Joints are classified based on their structure and function. There are three main types of structural classification: fibrous joints, which are immovable, such as skull sutures and teeth in sockets; cartilaginous joints, which are partially movable, like intervertebral discs and the pubic symphysis; and synovial joints, which are freely movable. Synovial joints can be further divided into several types: hinge joints, like the knee and elbow; ball and socket joints, such as the shoulder and hip; pivot joints, found in the neck between the atlas and axis; gliding or plane joints, like those in the wrist and ankle; saddle joints, such as the thumb; and condyloid or ellipsoid joints, like those in the wrist. Now, let's discuss common joint diseases and their treatment. Osteoarthritis, or OA, is the wear and tear of cartilage, with symptoms including pain, stiffness, swelling, and reduced movement. Treatment options include pain relief through NSAIDs or acetaminophen, physical therapy, weight management, and joint replacement in severe cases. Rheumatoid arthritis, or RA, is an autoimmune joint inflammation characterized by joint pain, swelling, fatigue, and morning stiffness. Treatment typically involves disease-modifying anti-rheumatic drugs, biologics, corticosteroids, and physical therapy. Gout is caused by the buildup of uric acid crystals, leading to sudden severe joint pain, redness, and swelling, commonly in the big toe. Treatment includes anti-inflammatory drugs, uric acid-lowering medications, and dietary changes to reduce purines and alcohol. Osteoporosis is the weakening of bones, increasing fracture risk, with symptoms like joint pain, fractures, and reduced height. Treatment options include calcium and vitamin D supplements, bisphosphonates, hormone therapy, and weight-bearing exercises. Bursitis is the inflammation of bursae, resulting in swelling, pain, and limited movement. Treatment involves rest, ice therapy, anti-inflammatory drugs, physical therapy, and corticosteroid injections. Tendinitis is the inflammation of tendons, with symptoms of pain, tenderness, and swelling. Treatment includes rest, ice, painkillers, physical therapy, and stretching exercises. Lastly, ankylosing spondylitis, or AS, is a chronic inflammation of the spine, leading to back pain, stiffness, and reduced flexibility. Treatment options include NSAIDs, biologics, physical therapy, and posture correction exercises. Would you like more details on any specific joint disease?